Good afternoon, Alexandria, and welcome to a special edition of Agenda Alexandria. My name is Frank Fannin, and I'm the chairman for 2020. Agenda Alexandria has been in our community for over 23 years. We hold monthly meetings and take a look at certain hot topics that are affecting the citizens of Alexandria. Well, the COVID-19 situation has affected everyone here in our community, and today we have three great panelists from our health department, economic development, and the school system to give you an up-to-date situation on what's going on in the city of Alexandria and how we're addressing the pandemic. I'd like to turn the program over now to our moderator and local journalist, Michael Lee Pope. Michael, thank you for hosting today, and feel free to take it away.
Welcome to the first ever virtual Agenda Alexandria. We're so excited to bring to you an expert panel of people to look at the COVID crisis here in Alexandria and how the city's dealing with it. So let's get right to it. We are very pleased to be joined by Dr. Stephen Haering, the director of the Alexandria Health Department, Stephanie Landrum, the head of the Alexandria Economic Partnership, and Katy Matthew of the PTA Council here in Alexandria. So we're looking at health and science, we're looking at the business community, we're looking at education and families. And without further ado, let's get right into it. Dr. Haering, thank you so much for joining us. I know you're busy. Thank you so much for carving out some time for Agenda Alexandria. We're calling our program Snapshot Alexandria. It's a snapshot in time. Dr. Haering, talk a little bit about where we are right
on here. It's really an honor, and I really appreciate the opportunity to help spread what the health department is doing, as well as the city of Alexandria. First, a little bit about global things that are going on. There's over 2.8 million cases globally and 194,000 deaths. In the United States, we're closing in on 1 million cases with over 52,000 deaths. In the Commonwealth of Virginia, there are more than 13,000 cases and 458 deaths. And then looking at Alexandria, we've had 627 cases, 18 deaths, unfortunately, and there have been 79 hospitalizations. When we look at the data that is available, a lot of the data isn't stratified to the level that we want, because a lot of practices are very busy and they don't give us all the information that we would like to have, both as a health department and as a city. But when we track the data in terms of the demographics, it looks like it tracks pretty much by age and by gender. We are seeing, just like the rest, disparities in terms of the severity of disease, and we're looking at severity of disease by the hospitalization rates. And African Americans in Alexandria have a greater hospitalization rate per capita than white Alexandrians. But in terms of deaths, all of the deaths of the 18 deaths all have occurred in people greater than age 50, and 11 of those have been age 70 and over. And that also tracks the national statistics. We know that COVID-19 disproportionately affects elders in terms of hospitalizations, the need for ventilators, and unfortunately for mortality.
We want to bring in our other guests. Before we do, though, just want to follow up with the health director in terms of kind of where things are right now. Every day, so the city every day numbers in terms of the cases, and it seems like the number that came out yesterday, last couple days was maybe even the last couple days was lower in terms of new cases. Sort of where is the city right now in terms of, where is the city right now in terms of, everyone talks about flattening the curve. Where is the city right now in terms of, where is the city right now in terms of numbers of new cases every day? Numbers of new cases every day.
You know, it's interesting. I've watched a webinar by national folks that look at modeling and look at quality assurance, and these are people that do this full time for their job. And they give New York as an example of how the numbers were going up. And then all of a sudden, one day the number would come down, and they were tracking mortality. And then the media and everybody was real excited that the number went down, but that was a one day. Then it shot back up, and then people reacted like, wow, we're not over it yet. And then it went down one day. It's really difficult to know when the curve has been flattened, when you've reached the apex, except when you're looking in the rearview mirror, except when you're looking in retrospect. So yeah, when we look day to day and we see that maybe it's dropped to 27, dropped to 16, that does not mean we're out of the woods by any means. A lot of people are asking us, when are we going to reach the apex? And there's lots of different models. I can say the measures that the city of Alexandria has undertaken is definitely working. The numbers are not as high as they would have been, very clearly. And so it's really not about the date that we're going to reach the apex. It's really about the data that we're watching to determine when it's safe to do some sort of calibrated reopening. And that's one of the things that we're developing both in Virginia and in the National Capital Region to help advise people about what is the proper calibrated reopening that will occur.
Stephanie Landrum. We're calling our event Snapshot Alexandria. Time. I'll put the snapshot question to you. How is the business community doing? I know lots of businesses have been applying for this federal Paycheck Protection Program, maybe even emergency economic relief. What have you been hearing from the business community about how they're dealing with this situation that we're in?
Thanks for having me, Michael. Well, the business community is trying to deal with this crisis as best they can. I think like we all are personally. This is an unexpected and completely catastrophic event for all sorts of businesses. And to identify sort of a silver lining at this juncture. But what's refreshing and perhaps inspiring is that our business community is very entrepreneurial. They're showing that they have the capability and the strength to pivot, and they're trying to find ways to remain resilient, looking at new business models, trying to find ways to keep employees paid and kind of on the payroll, but also recognizing that the safety of our community comes first. And Dr. Haering, his office works really closely with certain sectors of the business community that are involved in health, safety, food prep. And they have, I think, have had a really great relationship prior to this crisis, and it's only been made stronger throughout. You mentioned federal stimulus funding. That has been the first source of help for our business community. Our team, the Alexandria Economic Development Partnership, is the city's economic development agency. We also host the Small Business Development Center, which is sort of the face-to-face group that works with our smaller businesses within Alexandria, which is something that we tend to have a lot of. And we spent our first couple of weeks really just focused on what are the recovery options, what resources are available, and how do we make sure that every business understands what they're eligible for and how to access it. There's been obviously a lot of news on that front. The original proposal from the federal government included billions of dollars in two different loan types. One was an emergency disaster loan, and the second was this new payroll protection program, PPP. And while both are certainly helping businesses, the majority of businesses had never thought about having to apply for a disaster loan. And then this PPP program didn't even exist until just 3 weeks ago. And so there's been a huge curve, not only from the business community trying to learn how to qualify, what the process is to apply, but also from the banking community, which is the partner in the PPP program. And so there were a number of banks who had certainly done work with the SBA in the past and understood that process, but the majority of banks had not. And so you had both the businesses trying to figure out how to apply and what they would qualify for and what these rules were, which were frankly changing, continue to change. And then you had the actual banks, the instruments that were going to provide the money, also learning at the same time. So it's been It's been a challenging and frustrating process, I think, for many. I will say one of the things I talk a lot about with our team is that the number one role we play right now is to be kind of a calm voice. So any business that calls our office, hopefully there is some help that we can provide, but at worst, we are helping them. We're just listening, right? We're being a friendly face, someone that businesses can vent to. This is such a hard time for everyone, and it's so unprecedented that sometimes as a business owner, you just need a little bit of time to just get it out, and then turn around and figure out kind of what's your next path forward. The one other thing I would say is that while the initial impact seemed to be on those forward-facing businesses in hospitality and food service and retail, as the weeks go on, we certainly are seeing impacts across every industry. The bright side for Alexandria and for Northern Virginia is that this is one of those times that our dependence on the federal government is actually helping us. The federal government is still operating. People who do work for the federal government, federal contracts are still in place. And we probably have a higher percentage of professional service workers who are capable of working out of their homes. We don't have a large manufacturing base. We don't have a large distribution base where people have to go to work every day. And so while our unemployment and the impact here is devastating, it's not as devastating as it is in other parts of the country and even parts of the Commonwealth.
And give us an update. You mentioned the Paycheck Protection Program. Give us an update in terms of businesses that have been approved or, they've got the notification that they will be receiving money.
Sure. So last week, I think it was at the end of the week 2 weeks ago, we started to see the first businesses who had applied actually receive the dollars. And then moving into last week, we heard a lot more examples of businesses who were receiving the dollars. The program also ran out of money about 10 days ago, but I think as most people know, the president signed into law on Friday the CARES Act. I think they're referring to it as 3.5, where they're replenishing money into the PPP program. Those applications reopened today at 10:30 in the morning. And so that's great news for businesses who had an application in who had not heard anything. It also allows for businesses who had not previously applied to apply. Congress set aside somewhere in the range of $60 billion for businesses that they considered potentially didn't have an advantage during the first round. Small businesses, minority-owned businesses, women-owned, rural, who maybe didn't have a relationship with a bank. What we found and what everyone found kind of as this rolled out over the last few weeks was that because banks were learning how to do this at the same time businesses were, they sort of gave preferential treatment. Many of them gave preferential treatment to existing customers. And so an unintentional consequence of the way that the program rolled out is it potentially inhibited a business that had never really had to borrow money or had, an entrepreneur who had saved up enough money to start their business and didn't really have, didn't have a loan from a bank or have any debt with a bank. They potentially found themselves in a position where they couldn't apply. They couldn't get a bank to accept their application. So this next round set aside a good chunk of money for businesses like that. It also gave what we call the fintech, so financial technology businesses, an opportunity to figure out how they can play in this field, and they are serving a lot of that population. So what we're going to be working on this week as the second round sort of reopens is some more proactive outreach to businesses who potentially fall into that category, small, minority-owned, women-owned, and see if we can help gain access to this real lifeline of a grant program, grant/loan.
Katy Matthews, the Alexandria PTA Council, same question back to you in terms of Snapshot. Give us a snapshot of where the schools are and sort of what parents are thinking about the situation.
So thank you for having me. The schools right now are concentrating on, there were multiple tiers of what they were working on from the beginning, starting March 16th when the students were not to return. They closed the schools, and not returning was to make sure that our teachers were getting the needed educational things to the kids that could. So right now, Alexandria City Public Schools. Every student from 3rd grade to 12th grade needs a Chromebook that they use on a daily basis in school, and then as they get older at home for homework, to use to connect with their teachers and do their homework and that kind of thing. This just turned into, they just said, bring your Chromebooks home. We'll let you know what is happening once we know more. So the schools then started their plan on what they're going to do. It's a little different right now. The 3rd quarter for the secondary schools, middle school and high school, just ended on Friday. Today is a teacher work day, and then the 4th quarter starts tomorrow, where they will be getting new content, new education will be going out to all of those students. Elementary level is a little different because the students 5 get Chromebooks. They have been working the past couple weeks, having meetings, having actual classroom meetings with their teachers, and also then being assigned assignments based on, definitely age specific for that particular grade level. K through 2 is a little different. They don't receive Chromebooks for multiple reasons, but they have the local TV stations, cable stations have programming for those age groups. I think each channel is a different grade for those students, and then they were also sent home packets of work to do, along with art projects and that kind of thing, all appropriate for that grade. So right now, the actual curriculum, the teachers, our Alexandria teachers, they know how to do this. It's been fantastic. They know how to engage their students electronically and have been doing this actually for a while, which is fantastic. If you read in the paper or on the news, that some other jurisdictions are having some problems, which just shows the level of professionalism and that our teachers and our administrators has been fantastic. Right now, the one big problem, there's a couple problems, right? But the first one was getting those students. We have a very high percentage of students that are on free and reduced meals. So how do we and that's where they get their breakfast and lunches at school. How do these students get their meals? Right off the bat, our school district has been getting food out to our students using local charities, ACT and Alive, to get our banks to get our students the food that they need. There are pickup spots at multiple different schools and facilities around the city, multiple days a week for students to get questions asked. You come, you get your food, and you move on. Our PTAs have been contributing to that when it comes to money, and because the food banks actually ask, don't bring us food. We need the funding. And so our PTAs have been raising money for that. Our second issue that the schools have been working on that PTAC has also been working with is Wi-Fi. So 12% of Alexandria's students do not have internet at home, which was not that big of a deal while school is in session, because a lot of students are using their parents' cell phones as hotspots for that hour and a half of homework that they have at night, or they go to the libraries, they stay after school to do their homework with teachers, because there's always teachers that stay after for kids to do their work. But with this process of kids not being able to go where the internet is, that's a huge problem of how do you can have the teachers provide as much education as possible. The kids can't access it because they don't have internet. That's a problem. So the schools came together, changed their budgets around, and have purchased 700 additional personal hotspots and sent them to the homes that they know have students that need it. And so most of the students now that lacked internet actually have it now, have access to internet. And we continue to look, they're continuing to look at other ways of getting permanent internet to buildings, or even put in ACPS owned cars, and then they go move the car into the neighborhood where students would have, there's a large population of students without internet. They could log on because the internet had been moved into their neighborhood. So still working on that, but the personal hotspots have been deployed, and PTAC is raising money, used spring to action, and also unused funds, because we no longer have spring programming, are used funds to donate to this program that ACPS is doing.
So the Alexandria School Board recently passed a new grading philosophy where the students will either pass or have no grade. I'm wondering about the reaction of parents there. Do they feel like that there are potential problems with that? And then also, could that be a problem in the future when these students eventually apply to college? What's been the reaction that you've been hearing from parents in terms of this new grading philosophy?
Not negative at all. Kind of more like, okay, if this is, knowing that there is students out there that will find this very hard to not only log on and continue their work without the structure of school, we are more of an understanding of the parents that I have spoken with. No, I've not spoken with parents that are truly upset about it. I've not spoken to parents that are jumping for joy. Or like, this is what it is, and we don't want kids to get poor grades because we're social distancing and we have we're staying at home to be safe. So it's more like, this seems to be the best plan for all students.
And going back to Dr. Haering now, in your opening remarks, you talked about data and some frustration with maybe not getting all the data that you would like. Are there specific kinds of data that you're not receiving that you feel frustrated because you like more kinds of data?
Yeah, and it's not data that is just specific to Alexandria that's lacking. It's actually throughout Virginia and even the nation. And what it relates to is when a clinician fills out information about doing a test, they don't always provide all the necessary information that we want to be able to stratify according to different demographics that are affected. And up to a third of and even up to 35-40%, depending on which demographic category we're talking about, are not fully completed. So what we're doing is we're reaching out to those clinicians and advising them about how to properly fill out the forms. And then also our contact investigation team that calls every single person with a positive case to also do a contact tracing. And that means talking to all the people that they've had close contact with. We're gathering the missing data at that point going forward from this point on.
I'm wondering about that contact tracing because this seems like one of the next big things that's going to happen is your department and departments like it all over the country are going to need like an army of people to do contract tracing, right? Explain how that will look and feel, and how is that going to happen?
Absolutely. An army of contact tracers is exactly what we're starting to build right now. We've already redeployed all of our staff toward our pandemic response so that all of our nurses and our aides and our administrative staff are working in the incident command structure system. And we have different teams. We have surveillance teams, we have contact investigation teams, tracing teams, as well as teams that are focused on high-risk congregate settings. What the contact tracing looks like is we call a positive case, and first of all, we find out how they're doing. Are there any resources that they need that we would go to the city and the city, through its unified command, would determine how to get the resources to the person. The resources could be rent assistance, or it could be food, to help the person to isolate. Then we talk to the person and we say, okay, ever since you first became ill, plus 48 hours before that time, we want to talk to you about everybody that you've had a close contact with, everywhere you've been. And that's a rather, for most of the investigations, that takes quite a bit of time. And then what we do is we gather all those names and phone numbers, and we call those people and we tell them first to find out how they're doing. If they're ill, we advise them as to getting testing or medical attention, and we advise them to quarantine because they've been identified as somebody with a close contact. The idea is that before this became community-wide transmission, the ideal would be to identify and isolate and do contact tracing for every single person. We're at the point now, because of community transmission, that we only do the contact tracing for people that are in high-risk situations. If they work in an essential function, like they're fire, EMS, police, if they're a healthcare worker. The others, what we do is we tell the positive case, we give them information about how to do contact tracing on their own, and give them that information. If they're comfortable doing that, we have them do it with their own family and friends. As we move into the next phases of this pandemic, we'll move away from having the positive cases do that work. We'll return to the health department doing that 100%, and that will help us to determine if there is ongoing community transmission or not. Because as cases come in, if we're able to identify where the person got it from, in other words, if they have what we call an epi link or an epidemiologic link, they can, if they say, oh, I got it from Mr. X, and Mr. X was an identified case, then we can say that person has an epi link. And as the numbers diminish in future phases, we look forward to being able to do that identification and isolation of cases. We're not there yet. We're still in widespread community transmission at this juncture.
Stephanie Landrum, back to you in the business community. We've been hearing a lot about residential renters and the problems that they've been having meeting the rent and possibly even being evicted, and there's been lots of concerns about that. So there's been lots of discussion and, perhaps even the use of federal funds to help residential renters. I'm curious about commercial renters. Talk about whether or not businesses in Alexandria have been able to meet their rent obligations.
Big question, certainly, that we have been hearing a lot of. I'd say in the businesses that we've talked to, which has been probably almost 1,000 at this point, through surveys, through them reaching out to both of our organizations, there are probably 4 key things that businesses want to talk to us about. Number one is grant assistance and help working through the federal loan process. Also looking for any other type of additional financial assistance, and we have looked at and pointed businesses to a variety of different resources from private sector partners. The third thing would be assistance with negotiating with their landlord to talk about their rent obligation. And then the last is more about their tax burden. And so we've been trying to address all 4 of those. And I guess maybe I should say the number one issue that most businesses have reached out to talk about is how to take care of their employees. And I don't want to overshadow that. The business community has been, this has really been gut-wrenching for them. So many of our business owners, this is sort of a lifelong dream to start a business. They work really hard to not only provide for themselves, but to provide, to create this opportunity for their employees, and to face a decision like furlough or letting or layoffs is really just been probably the most difficult thing for all of the business owners. On the commercial rent side, our team has been spending a significant amount of time talking through with the business owner about what their options are, and then helping facilitate conversations with landlords. And while we're still in the very midst of this crisis, and we certainly are collecting information, and I think when we get to the other side of it, we'll be able to report provide some really great metrics. What I can say anecdotally is that there are very few landlords who have not approached the rent issue from a problem-solving standpoint. Landlords have their own economics that they're dealing with. Most of them have a mortgage or some sort of bill that they need to pay. And so recognizing that, and that's a lot of what we talk to the tenants about, recognizing that and then coming up with solutions has been kind of the best path forward. Some examples of the way that this has worked is a business that has seen a complete stop of business has been able to, a number of them have been able to work with their landlord to defer payment of rent. So one option from a landlord's perspective, the thing that is most valuable to them is to have a paying tenant for a certain period of time. They're able to take out loans, mortgages, et cetera, based on that. And so we have advised and worked with tenants to help them defer their payment of rent for these couple of months now where the impact is really strong, and potentially extend their lease on the back end. So you're creating value for the landlord by committing to stay for a longer period of time, and you're getting the immediate relief that you need. Another strategy we've used is that for businesses who haven't seen a complete stop of revenue but have seen an impact, is to negotiate a partial rent payment. The message that we have been saying to both the tenants and the landlords is just be transparent. These are unprecedented times. No one has a playbook for how this is supposed to work, and recognizing that your landlord is not is not a greedy entity that's just looking to make money, that they too are going through difficult times, and kind of sharing that information and figuring out the path that works best. Again, I can only kind of share anecdotes right now, but anecdotally, we've seen really, really great, I think, conversations happening from mom and pop owned buildings up to what we call REITs, real estate investment trust owned buildings. The other thing that I would say, especially for our retail and restaurant tenants, is that it's really expensive for a landlord to remove a tenant, go out and find a new one, do the build out for them. So it's actually in their financial best interest to work with the tenant to keep them in place and to help them survive this, hopefully finite amount of time that they will be completely out of business.
You mentioned earlier that the AEDP had been surveying businesses. I know one thing that you've been talking to businesses about is different kinds of grants, disaster grants versus matching grants for improving online sales versus like reopening, reestablishing grants. Talk a little bit about these different kind of grants and what you're hearing from the business community.
So right now, our focus has been on helping the businesses access the federal programs that we talked about earlier, the EIDL and the PPP. From a scale perspective and from an amount of money perspective, the federal government is really the only entity that's going to be able to address the sheer, magnitude of businesses that need help. So that's been our focus in this first kind of phase, which is really just immediate response. The second phase that we're calling stabilization, I think we will be looking at providing some resources at the city level. We'll be talking with City Council tomorrow night at their Tuesday legislative meeting about some options to help during that stabilization phase. And then the third phase is really recovery. And as Dr. Haering said, we're not quite sure when that phase starts, but I think we want to be sure that our businesses are prepared to recover under a new set of circumstances. As the governor will lay out, and he started to lay out on Friday during a press conference and following news release, the recovery period will have new rules of engagement for all sorts of businesses, not just restaurants and retail, but office buildings, people who work in kind of flex office space. We have some really interesting businesses in Alexandria that are, makerspace or co-working. So we need to make sure that those businesses understand what the new rules of engagement are, and we could potentially be in a position to help them either modify their spaces as might be required, obtain PPE and other kind of equipment that they might need in order to operate. There's been a lot of talk about like temperature testing of employees, is there some equipment there that we might be able to help with? So we're going to talk through with City Council tomorrow some recommendations about how the city might be able to help in the stabilization and recovery phase.
Katy Matthews, at the beginning of when you were explaining what was going on in the school system, you went through a very wide variety of different kinds of models based on which grade the student was in. And I'm curious as to sort of the diversity you're seeing in terms of what's happening in the virtual classrooms. I was speaking to a teacher recently who was saying that in Fairfax County, it was this top-down model where they were trying to use Blackboard, and as we all know, it didn't really go all that well. Whereas in Alexandria, the approach was very different. I had one teacher describe it to me as kind of like guerrilla warfare. You just grab whatever weapon is available to you and start shooting. I'm wondering if you could talk a little bit about this diversity of what parents are seeing in terms of different models, and which models are kind of working better, maybe, and which ones might not work quite as well.
Sure. I think they're using, I'm seeing, so I have an elementary student and a middle schooler student. And so I am seeing completely different types of teaching. They both do Zoom meetings to meet with their teachers. It has been extremely helpful for my youngest, who's in 4th grade, to be able to see her fellow students and her teacher on a regular basis, extremely, because in the beginning of this, we didn't have that. And it has been, I can't say extremely enough, very helpful to get her focused on the work that she needs to do. And they're using multiple different ways of doing that. They did originally send home a packet of paper. They are having them do online work programs, applications for math and reading comprehension. They are sending them emails with just literally like PDFs of paper documents that they would normally have gotten in paper in classroom. So it is for her, there's a lot of different types of ways that they're connecting to the students. And so I would say that it's pretty diverse, everything from paper using, for her to color and learn and reading comprehension and writing out what she's learned, to doing what's called IXL and in math, where it's a program and she's got to get to a certain amount. She's got to get to a certain level by a certain date, which they've always had. It's a program. It's more of their homework, but now that's her classwork also. To then my son, who's a 7th grader, who gets an email from every class teacher that he has, and for that day's work. And it could just be review, or it could be it will be new educational content starting tomorrow. And it's everything from videos where the teachers are videoing themselves and doing lectures, or watching different programs that they might have watched in class. Like in his Spanish class, he might be watching that, but I'm sure that they're deploying that. Also online programming, almost even online games. My son is a sports fanatic and very competitive, and he totally got engaged with a Spanish program that he was playing against his fellow classmates, and really liked that. The teachers are definitely deploying a diverse amount of ways to engage the students, because it is hard, to engage all of them. They've got to be able to, they need to be able to wake up, get online. This is all new territory for them. Usually they go to a class and the teacher tells them what they need to do. Now they have to know to go to email, check their email, read what each teacher has told them they need to do, or go to Canvas where there's announcements. There's multiple ways that they have to check in to find out what's going on. So it is new territory. And so the teachers are trying to keep them engaged. And I think that they are doing an excellent job. I know my colleagues in the PTA world are extremely thankful for what the teachers are doing. And so I feel like we are a top-notch teaching staff in the city because of that.
I'm curious if anything is standing out. In other words, is there a particular teacher that's doing something that's really innovative that parents are responding to, or is there a particular school that's doing something that maybe the other schools aren't doing? Does anything sort of stand out or is worth mentioning?
No, because the teachers are all doing it. It is every school. It is every school, every teacher that you do not have. I've not heard one thing bad about any school or any teacher. They, in the beginning, there were different schools doing different things, but they're now all, I think, on the same curriculum and doing very similar things that are all engaging. I do know that they talk to each other, and they are, because they have a network, and they are helping each other tell them what is engaging the kids the most. And there are different tactics.
Dr. Haering, returning to the health part of this, earlier we were talking about data and the availability of data. I know one thing that's been frustrating is sort of the lack of localized data. In other words, the number of cases that are in a certain zip code, or even the number of cases that are in a census tract, in other words, a neighborhood. Explain how much data, localized data, is out there, and if we would ever get access to sort of zip code by zip code, because I know other states in New York and Ohio, you can get this really localized data that we don't have access to in Virginia. I'm wondering, sort of, do you have access to that information, or is there any time that we might have access to that information?
Yeah, thanks for asking that, because we do get asked that quite a bit. First of all, we do have quite a bit of data in terms of gender, age, and race. Virginia Department of Health does not provide data by the census tract or by the zip code. And the reason for that is because of privacy concerns. Virginia Department of Health, Alexandria Health Department, all the health departments have a lot of very sensitive data about people. And what we don't do is divulge any sort of information that might lose the public trust in all the data that we have. We would, if we had a public health need to know that there were a specific location or locations that had potential exposures to the point that we could not do our contact tracing. An example would be if there was a church that was open and somebody was sick and went to it, and we were not able to identify all the people that person had close contacts with. So then we might put out a media release that during this period of time, anybody that was at this church or this facility or this business may have been exposed. Please call this number. Fairfax, to give you an example, Fairfax recently created some geographic maps in terms of the impact in Fairfax County, but they used just the first 3 digits of the zip code. So if you look at the map of Alexandria, 7 of 8 of our zip codes all share the first 3 digits, and that final zip code only involves 2 streets. So even if we went by way of the Fairfax model, the closest that we would get is what we're getting right now, is the entire city as a block. All that being said, when the health department learns and either from somebody or identifies from the data that's coming in that there are specific areas that need more attention, an example would be a long-term care facility, for instance. When we identify 2 or more cases within any long-term care facility, whether it's a skilled nursing facility or an assisted living facility, we increase our attention. We're already, for all of the facilities, providing them information and guidance. We provide them training about how to properly put on an N95 respirator. We give them the personal protective equipment, the PPE. But when we learn that there's a case going on or cases going on at a long-term care facility or any congregate living facility, then we actually increase the amount of guidance, increase the amount of attention that we provide to that facility, to that area.
So on the demographics, there was initially there's been lots of concern about a disproportionate impact on the African American community, and early on there was not a lot of data on that. So in other words, the state was reporting the data that it had, but in most cases it didn't have any racial data. And as it turns out, I think you might have alluded to this earlier, the people actually administering the tests just weren't writing that data down. So it wasn't that the state wasn't reporting it, it's that they weren't receiving it. And then the governor sort of asked healthcare providers to start providing that. And earlier you mentioned that here in Alexandria, the numbers that you had showed a greater hospitalization rate for African Americans. Explain that, and what is this thinking in terms of why that might be the case?
Well, that's correct. The data that we have shows that of the hospitalizations and the data we have, that 30 of the hospitalizations have been of white Alexandrians and 26 of black Alexandrians. And we would expect from a demographic, just from a strict demographic, that the ratio would be 2 to 1, white to black. But then on the other hand, the data doesn't really surprise us, those of us in public health and those of us who have been working in community health for some time. Our community health assessment was a 2-year process that ended in 2019 and led to our community health improvement plan. It demonstrated disparate health outcomes according to race, income, according to ethnicity, according to the type of jobs that you have. So the sorts of things that we're seeing in the pandemic, it's actually just magnified in a shorter period of time. So our focus, both as the health department and as a city, has really been to conduct increased outreach to those communities that have a greater impact, because the virus itself doesn't discriminate, but the impact it has on people does, according to their income, type of job, whether they have a job or not, whether the job has sick benefits. For instance, if you're ill, can you take off and still get paid? And then by race.
So on Facebook, Delegate Mark Levine is asking about availability of some of this information. You mentioned at assisted living facilities, nursing homes, that if there was a cluster of this information, a cluster of these cases, it would be part of the public record. Where can people go to find this kind of information?
Yes, it is on the Virginia Department of Health website. And that website, you can go to vdh.virginia.gov/coronavirus. You can also access that by way of the Alexandria website, which is alexandriava.gov/coronavirus. And there's a hyperlink to that.
But now
at the bottom of that,
the data,
it shows
the data on
it
the
shows
specific
the outbreaks.
facilities is not as specific, I think, as a lot of people would like. Explain how the data is presented in terms of, like, don't they strip it of the name of the institution?
That's correct. The actual institution is not named in the data presentation because Virginia Department of Health treats that data just like it's a person. And so what we do with that data, though, we in the health department do know which facilities those are, and we share that information with the other facilities. And that is by direction and by permission of the Commissioner of Health, recognizing that other facilities want to know that information in case they have healthcare workers that have multiple jobs. That way they can help to identify those folks that they perhaps should exclude from work during a period of time that they should not be coming to work.
Stephanie Landrum, back to the business community. We talked a little bit about reopening, restructuring. I'm wondering what efforts are out there in the business community. You have all these places that are closed right now. Everyone's hoping to reopen, but when those reopenings happen, it won't look like it did before, right? Talk about the preparations that businesses are putting into place to envision a time when they reopen, but people have to stand 6 feet apart from each other or wear masks, or how is the business community planning to reopen?
Right. So I think it differs by industry, and I think all of the industries are really relying on and partnering with the health department, at the local and state level, but also looking at guidance from CDC and FDA. They are the ones who have complete information and can make the best recommendations. A lot of the restaurants, I think, have learned a lot and are learning a lot right now as they've pivoted into curbside pickup only. And if you, hopefully, Alexandrians watching have been taking advantage and supporting our local businesses by doing some of this contactless pickup and really trying to help the businesses survive this period. But if you go and you see some of these businesses, you'll see some of the things that they've done just from the exterior. A lot of that will carry forward when they're able to reopen. Industries like that occupy office space, I think, are going to have to think very differently about the way that they space their employees. The trend in commercial real estate over the past 6 years has really been to densify. You've heard terms like office hoteling, hot desks. And the idea there was that people no longer kind of had assigned places to work, and depending on who was traveling or teleworking or, in meetings, you might just show up and plug in your computer on a desk that the next day would be used by somebody else. We are starting to talk with landlords and those in the commercial real estate industry about what the new norms will be, given the sensitivity to germs and virus spread. And so when you really start to think about what business might look like during recovery, which could be, as long as multiple years, I think you will see office tenants looking at space differently. The flip to that, though, is that many businesses were forced to implement 100% telework well before maybe they would have been ready to do so. And I think that many of them will learn that it's not the end of the world, and that a portion of their workforce could and should remain teleworking. And so that will have an impact on their physical footprint. It also will have an impact on the business community. So when we think about our major business districts in Alexandria, Old Town and Delray and Carlisle, Eisenhower Avenue, Potomac Yard that we're trying to build out, we spend a lot of time trying to make sure there's a right mix of restaurants and nightlife and, supporting retail to support not only the people who live there, but the office tenants. If all of a sudden the number of office tenants drops, we need to make sure that that the number of residential tenants kind of increases in order to support all of those businesses. So there are some very immediate local issues that we will deal with, like in terms of helping businesses reopen. But I think we also are thinking strategically about the way we plan for future development, what the right mix is, and what impact this pandemic will have on us long term.
And Katy Matthews, I'm curious about frustrations that parents are having. So suddenly they're in this position where they're with their children all day and they're trying to help them with their schooling. I'm wondering if parents are feeling like the school system should be doing something that they're not doing, or what are you hearing from parents about what other things the school system could be doing?
Nothing. I mean, there's definite frustration of being home, trying to do your own work, and then still have young children at home and keep them entertained, and get them through their education, what they've been assigned. There is frustration with that, but I believe that I have not heard one parent complain about what our school district is doing. It might be different if there were not other stories out there of problems in the other districts. I personally have not heard one single thing. There's rumors here and there of certain teachers not engaging as much as others, and we all believe that will end starting on tomorrow, because it's the fourth quarter for the upper grades. It's all new content. And so that frustration is just like, there isn't much. It's more the frustration of being a parent, working, and also having feeling like they're have to engage help their children engage in their education. That's where the frustration is. And again, it just goes to the foresight of our district, of our school district, and how to engage our students and how they are engaging our students. There's also a frustration of certain kids do not get Chromebooks. I have heard of the frustration that the K-2 kids don't get Chromebooks. And there are probably a population, a percentage of second graders that might know how to use a Chromebook responsibly, but they have not gotten, but the school curriculum has not gotten them there yet, and so the schools are not giving them Chromebooks. So there has been, I've heard a little bit of that frustration, but they also, I also think that they also understand why, of multiple reasons why they don't have them. So that's, I believe, the frustration. Honestly, I've heard from other districts of much worse across the country. I have college friends, that are also parents, who are extremely impressed with what our students are going through, what our norm is, that they are just, very almost confused. They're like, wait, what? Your kids have been engaged since day one? So it is, it's proud. And so that when parents start, starting to want to, complain or gripe, they also like, well, wait a second, no, we have it really good here. And we'll just, we're going to do our best and make it through it. So that's kind of where we stand, I think.
Excellent. So we're coming up on the 1 hour mark, and I want to be respectful of everyone's time, so we have to wrap it up. Let's go once around the horn here in terms of maybe telling us something that's sort of the most important thing that people should know that they don't know about your area that you're talking about today. So Dr. Haering, we'll start with you. Anything that you feel like people don't know that they should know, or any sort of parting words that you have for our Agenda Alexandria today?
The Alexandria Health Department is doing a whole lot of work in many, many different areas. We recognize that a lot of people are making a lot of sacrifices, and what we're trying to do is minimize the impact of the virus on the community as a whole. Some of the things that we're doing is there's huge amounts of information that's coming out every day. We're synthesizing that information and we're sending it out to specific groups, whether it's city departments, agencies, businesses, congregate living facilities, the jail and detention center, specific groups like ARHA. We're really working to help people to understand the complex information that's coming out into very simple steps that they can take to help protect themselves, to help protect their loved ones, their businesses. We're working a whole lot with the healthcare worker community, with the providers. We're giving them information, guidance, PPE, training, so that they can do more and more testing. And I think everybody knows, stay home. Everybody knows to wash their hands a lot, 20 seconds after you've touched a commonly touched surface. But really that concept of your health depends on my health, and my health depends on your health. And those folks in our community who are particularly vulnerable for really severe disease, and I'm talking about the people who are over the age of 65, people who have diabetes, heart disease, lung disease, on dialysis, their health depends on the entire community health. So with all the sacrifices, all the measures that are being taken place, this is going to be a long road. I can't say exactly how long, but it's not going to be over until we have an effective and safe treatment and/or an effective and safe vaccine. So it's going to be some time before we're, quote, back to normal or even a new normal. I appreciate what everybody is doing, both on this call as well as throughout the city, to really address this community health pandemic issue. So thank you very much for having me here.
Thank you for joining us. Stephanie Landrum, any other thoughts in terms of what people should know about the business community, or any parting words you've got for Agenda Alexandria?
I would tell the business community, those of you watching and those of you who know business owners, have them reach out to our team. Even if they don't think that there's anything we can do to help, being plugged into the resources that continue to change literally on a day-by-day basis can and should be helpful. An easy way to find that information is on our website, alexandriaecon.org, and we have a page dedicated to the COVID-19 resources. There is so much information to take in, to assess, and to figure out. And so we try to organize it and send it out on a really kind of regular basis. And we really would like to be in touch with all of the businesses in Alexandria to make sure that as many as possible can survive. I guess my parting note would be Alexandria has such a large and strong history of entrepreneurship and innovation. We pitch Alexandria as kind of the home of intellectual property and innovation with some of our federal partners who are here. And through this very difficult time, kind of the saying about necessity is the mother of invention, seeing what some of our businesses have done so far to respond to this crisis, and seeing how people are putting their intellectual property, their smarts to work to help us solve this crisis, gives me a lot of hope for what can happen as we get through to the other end. And so just know that we're trying to find as many ways as possible to support businesses who are trying to pivot, who are trying to help, and also trying to survive.
And Katy Matthews, same question to you. Any other thing that people should know about the school system that maybe they don't know, or any other parting words you've got for Agenda Alexandria today?
I would just say that we have an amazing school district, if you haven't gotten that from me before, and that if there are parents out there that have questions about classes, the teacher, like email the teacher, email your administrator. They are happy to respond. In fact, they'll probably respond immediately. They miss their students, and they want to help parents as much as they can. And so just contacting them is the best plan if there are any questions when it comes to the education of their children.
Well, great. I'd like to thank everyone for joining us today. This is our first ever virtual Agenda Alexandria, so hope it went well. I'd like to thank Ricardo Alfaro for making all this possible, one of our board members who's doing all the tech stuff that made it look so slick. So thank you so much for joining us. We will get through this, and Agenda Alexandria will be doing another virtual panel again next month. We haven't decided exactly what yet, but we will be doing that soon. So thank you so much for watching today.